Welcome to Light Body Radio, where science meets soul and healing gets multidimensional. I am your host, Dr. Lara May, functional medicine pharmacist, master intuitive Reiki channel, and certified life and health coach. Here we decode root causes, transmute stuck energy, and empower your full spectrum healing journey, body, mind, and light body. This isn't just wellness, it's awakening, grounded in science, guided by spirit, and designed for your evolution. Let's rise and radiate. Welcome to the next level of you. Hello and welcome to Light Body Radio. I'm your host, Dr. Lara May. And today in this Wellness Illuminated episode, we are going to be talking about what does prevention actually mean and what does it look like through the lens of functional medicine. So within the realm of traditional Western medicine, allopathic medicine, there is often an emphasis on screenings and early disease detection, which is, while helpful, it usually still catches illness only after it has begun. So if you think about colonoscopies, you'll detect colon cancer, or mammograms, you'll find a breast cancer. And this is considered preventative medicine within the allopathic world. But really, what does real prevention look like? How can we prevent even those cells from getting to the point where they are cancerous? And so in contrast, functional medicine sees prevention as proactively identifying and then correcting imbalances and uncovering root causes long before any symptoms arise, and or if you're having symptoms, nipping those in the bud and creating homeostasis and rebalancing not only the system that's inflamed, but then your entire body. So true prevention really involves nurturing optimal function in all body systems: digestive, hormonal, immune, neurological, metabolic. So we really want to foster a robust health and wellness and resilience from within. So let's move on and talk about some of the foundational pillars of functional medicine and really how they frame prevention specifically. So of course, we're talking about functional medicine, so we're going to talk about food as medicine, nutrition. That is the foundation. And what we eat, we are what we eat, essentially. So what we eat profoundly shapes our cellular health, our inflammation response, and our immune response, our immunity. So adopting things like a Mediterranean diet or an anti-inflammatory diet can be very, very beneficial, not only in terms of maintaining health, but really creating health and dampening down some whatever inflammation might be present in your body currently. So what is a Mediterranean diet? Because I think we hear that a lot in the media and maybe even the news, or anytime health is talked about, people talk about, oh, well, a Mediterranean diet's a great option. So what is that? It's an abundant intake of fresh vegetables and fruits. So we're getting our vitamins, antioxidants, and fiber from plants, fresh food, ideally, if we can afford it and if it's available, organic, non-GMO, and healthy fats from sources like extra virgin olive oil, avocados, nuts, seeds. This supports our cardiovascular health and helps reduce inflammation. And we want a good consumption of the right amount of protein. And I don't know if you've heard lately, but this discussion on what is the right amount of protein is actually been a hot topic in a lot of circles these days, especially functional medicine and nutrition circles, because surprise, surprise, the age-old recommendations by the FDA and our other nutrition organizations, even like the ADA, for example, are a little insufficient. So you probably actually need more protein than you actually are consuming and or think that you do. So I would look into that. I'm not going to go down that rabbit hole today, but definitely look up how much protein you should be taking in every day, and make sure it's coming from good, clean sources. Again, organic, pasture raised. I don't care what kind of meat you eat. I'm a fan of red meat, actually, as long as it comes from healthy animals. Because again, you are what you eat. If you're eating meat from a stressed, inflamed, or sick animal, I don't care if it's a bird or a cow or a pig, or even if it's a game animal, then you are ingesting that diseased tissue, and it's going to not only make it harder for your body to assimilate, but it also could confer some inflammation into your body, which is exactly what you don't want. So we want to make sure that we're getting a good amount of omega-3s. This is really a cornerstone of a Mediterranean style diet. And where do those omega-3 fatty acids come from? They come from fish, seafood. They can also come from seeds. So chia seeds, flax seeds, hemp seeds are all really high in omega-3 fatty acids. And this, excuse me, helps reduce inflammation and supports cognitive function. So if you find that you're sort of being challenged with brain fog or focus lately, then it probably wouldn't hurt to maybe add in either an omega-3 fatty acid supplement, or increase, with deliberate intention, increase the amount of omega-3 foods that you eat. This is a very anti-inflammatory way to eat because of these omega-3s, and so it's really going to help decrease your risk of chronic diseases such as diabetes, cancer, heart disease. And studies have shown those that adopt a Mediterranean-style diet can reduce their cardiovascular disease risk by up to 25 to 30% compared to a typical Western diet. So that's pretty significant, especially if there's a genetic component to cardiac disease in your family. I think it's definitely worth implementing this style of eating. So the next like foundational aspect is gut health. And a healthy microbiome contributes significantly not only to your immune function, obviously your digestion, but also your mental health. Most of the serotonin that is circulated and then used in the brain is produced in your gut. So if your microbiome is out of balance, then that can be a reflection, also be reflected in your mental state. So do you suffer with anxiety or depression? Have you seen ebbs and flows in those things? Maybe if you're seeing an uptick of your anxiety symptoms, it's time to look at your gut health and see what's going on. So we want to make sure we have a regular intake of good probiotics. If you're a dairy eater, that can mean yogurt. If you're a vegan or a non-dairy eater like myself, I'm not a vegan, but I stay away from dairy, then that could be a coconut milk-based yogurt, or it could be fermented foods like kimchi, kombucha, pickles. So anything that's fermented is going to naturally have a good amount of probiotics in it. So, and that's going to help inoculate your GI tract with the good bugs. So we can also decrease illness duration by having a healthy gut. And so we can actually reduce not only the incidences of common infections that run through our communities, but the duration and how long they affect us by up to 20% if you have a healthy gut and a healthy microbiome. So that's I think something significant to keep in mind too. So the next aspect is stress mitigation. Chronic stress elevates cortisol, which increases inflammation, which increases your risk of chronic disease, which increases your risk of diabetes. Cortisol itself directly tells your body to release glucose into the bloodstream. So if you're stressed out, then by definition, automatically, your blood glucose is higher than it should be, or higher than it would be if you weren't otherwise stressed. So practices such as meditation, yoga, just taking a walk, have really shown to reduce cortisol levels by up to 30%, again, significantly lowering the risk of chronic conditions such as hypertension, heart disease, anxiety, diabetes. I could go on, but I won't because we need to keep moving. So the next aspect is sleep quality. So poor sleep significantly raises the risk of obesity, heart disease, and cognitive decline. So if you're one of those people out there that is in need of a CPAP, knows they should be wearing one but isn't, and or you are wearing your CPAP, make sure that that CPAP is evaluating and operating properly and providing you the amount of oxygen that your brain needs. Because especially if you have sleep apnea and you're not wearing a CPAP, then you are essentially causing brain cell death every night that you struggle with sleep. So achieving consistent restorative sleep, 7 to 9 hours nightly, depending on you and your body, is shown to reduce heart disease risk by up to 45%. And again, really improves cognitive function. And or if you're on the opposite end of the spectrum and really struggling, it could really impact your decline of cognitive function. So it's really important. I cannot stress this enough. So the next piece is movement and exercise. So regular physical activity, even walking, cycling, reduces the risk of diabetes by up to 40% and overall mortality by 30%. So exercise boosts your moods, it balances hormones, it reduces inflammation. If you take a walk immediately after you've had a good meal, it also lowers your blood sugar and helps your body metabolize that meal better. And so it decreases your risk of what we call the postprandial hyperglycemia. So it can be really helpful if you're pre-diabetic or already on diabetic meds, or you know you're diabetic, then taking a walk after you eat is extremely important and helpful. But a regular movement practice is really foundational as well. And then the next piece is developing resilience, the ability to effectively adapt to stressors. So strengthening your mental and physical health, resilience building practices like gratitude journaling, mindfulness meditation, positive social interactions, emotional regulation skills, all of these things dramatically lower the risk associated with stress-related illnesses. And really, let's be honest, aren't all illnesses stress-related illnesses, but also mental health disorders. So again, there's so many of us out there that have struggled in the past or are currently struggling with different varieties of mental health challenges. And so cultivating this resilience is really important. So the other piece that I could not have this episode without mentioning, because we're talking about prevention and of course through the lens of functional medicine, is that functional medicine lab testing. Proactive lab testing provides insight into imbalances or potential issues before symptoms manifest. So what does this look like? For both men and women, we want comprehensive hormone panels. I don't want to see just your TSH, or I don't want to see just a spot check on, especially if you're still a cycling female. I don't need to see like random spot check hormone numbers. I want to know where you are in your cycle, what day that we're taking this lab work, so we can look at it. And so it's not just a number in a vacuum. We have context. So comprehensive hormone panels of multiple aspects of all of the hormonal systems. That's what we want to look at. Because why? Because we want to look at your cortisol, estrogen, progesterone, testosterone, all your thyroid hormones, insulin, because we want to be able to detect imbalances that are linked to the stress, to the metabolic disorders, to various hormonal issues. Again, to be proactive, to catch maybe what we call subclinical imbalances before they develop into a full-blown clinical presentation or disease state. So again, we're also going to test for nutrient deficiencies. We're going to analyze your microbiome, and we're going to look for inflammatory markers, excuse me again, such as your CRP, which is your C-reactive protein, homocysteine, and your ESR, your erythrocyte sedimentation rate. So all of these are inflammatory markers. And by looking at these, we can keep an eye on risk for heart disease, risk for autoimmune conditions, and risk for metabolic syndromes. And then if we want to get really fancy and dig really deep, we can also do some genetic testing. Now, the genetic testing doesn't need to be done annually. It's a one and done type of thing, because obviously your DNA is not changing. However, you could be developing mutations But overall, your genetic makeup is what it is, but we can tell a lot by looking at it. So if you've ever had it done, it's definitely worth downloading that raw data and sharing it with your functional medicine provider, so they can figure out like which SNPs that you're heterozygous for, homozygous, how they're showing up in your body or not, or what your risk is, for example. So again, I'll leave that alone, but I won't go down that rabbit hole. But anyway, so prevention through functional medicine is all about fostering optimal wellness rather than merely avoiding illnesses. It's empowered, it's intentional, really, because we want to help you heal and thrive. And we want to be able to give you the tools so that your body can do that naturally on its own. And it definitely can. Your body, it wants to be in a state of homeostasis, in a state of balance. All it needs is for us to give it the tools and to not wear it down to death, and literally like beat ourselves up to death. So I would definitely encourage you to investigate everything that I've said. See, how it sits with you. See what you're doing, what you're not doing. And, just give yourself an honest look about where you are and maybe where you could use some improvement, or maybe where you're already doing a great job and give yourself some congratulations for that. So I want to thank you guys for tuning in today. Be sure to subscribe to Light Body Radio. Share this episode if you found it helpful. Make sure to follow me on the socials at Dr. Lara May. And until next time, remember that your health is your greatest wealth. So take care of yourself. Thank you for joining me on Light Body Radio, where functional medicine meets intuitive healing and transformation happens on every level. If this episode resonated with you, please like, share, and if you're ready to go deeper, visit deeper.Dr to book a functional medicine consultation or an intuitive healing session. Whether you need to rebalance your body, clear your energetic blocks, or reconnect with your soul's purpose, I've got you. You can also follow me on Instagram or TikTok at Dr. Lara May for daily inspiration, energy updates, and healing tools. Remember, your healing is multidimensional, and so are you. Until next time, honor your body, trust your intuition, and activate your light.